Hi there, this is Amelia Heart and Vascular, and today we're going to present to you what atrial flutter is. What is atrial flutter? Atrial flutter is a type of heartbeat that causes a fast heart rate. This is due to an issue with the heart's electrical system that causes the upper parts of the heart to beat rapidly. In this drawing, I'm going to show you how the upper chamber can beat rapidly. The electric signal goes from the right atrium down to the ventricles, but in the case of atrial flutter, there's a signal that circulates in the right atrium, causing that upper chamber to beat rapidly, instead of just once. Now let's compare a normal rhythm heart to a heart with atrial flutter. I want to make a note that the left and the right side of the heart are switched, and it should be the opposite direction. But it still gives us the same kind of concept to understand. The SA node, where the pacemaker cells are in the heart, will fire in the right atrium, and this will cause a signal to come down to the ventricles and cause the heart to pump. But in a heart with atrial flutter, you'll see that the signal circulates in the atria in the upper chamber of the heart, causing it to beat rapidly instead of only once, the way it does in a normal rhythm heart. Now that we know what atrial flutter is, we can talk about the two kinds of atrial flutter. The first kind is paroxysmal atrial flutter. This is when atrial flutter can come and go. An episode of atrial flutter can last hours or days, but a patient may come in and out of atrial flutter and sometimes present as normal sinus rhythm or a normal rhythm in their heart. And so paroxysmal atrial flutter is not always caught, and sometimes a patient can come in and out of it and they have a certain percentage in an abnormal rhythm. On the other hand, persistent atrial flutter is more or less permanent, and for most of the time, the patient is in atrial flutter. I now want to clear up what the differences of atrial flutter and Afib are. They're both irregular rhythms in the heart, but they are not the same thing. So if you know someone with Afib, atrial flutter is not the same as Afib, and I want to show you that difference today. So atrial flutter is electrical impulses that don't travel in a straight line from the top of your heart to the bottom. They circulate in the upper chambers. This causes the heart to beat too fast, but it still beats in a steady rhythm. Meanwhile, atrial fibrillation does not have a steady rhythm. The electrical impulses traveling through the atrium are fast and disorderly, and this causes the heart to beat fast in a chaotic rhythm. So here I'm drawing atrial flutter. You can see that the signal is still steady from the top to the bottom, but just circulates in the upper chamber. Meanwhile, in Afib, the beat is chaotic and the signal kind of fires everywhere throughout the heart. So we now understand different kinds of atrial flutter, the difference between atrial flutter and a normal rhythm, and also versus Afib. So let's talk about the causes of atrial flutter. There are a lot of causes of atrial flutter, and you may never figure out why, but these are some of the causes that are linked to it. The first is atherosclerosis. This is when there's low blood flow to the heart because there's plaque buildup in the arteries around the heart, and this can cause stress on your heart and lead to atrial flutter. The second is hypertension. High blood pressure can also cause stress on the heart and lead to atrial flutter. The third is cardiomyopathy or hypertrophy, which are enlargements of the heart or disease of the heart muscle, which can yet again cause stress on the heart and cause atrial flutter. The fourth is abnormal heart valves. Tightening or leakiness of these valves can trigger stress in the heart and cause abnormal rhythms. And the last is open heart surgery. Obviously, a surgery like this is really stressful on your body, and your heart can have irregular rhythms after the surgery. There are causes, though, outside of your cardiovascular system that can cause atrial flutter. And we don't always know why, but we have found some correlations of what can cause atrial flutter outside of the heart. The first one is hyperthyroidism. Having an overactive thyroid gland can trigger abnormal rhythms in your heart, and we see this a lot. So it's really important to get your blood work done if you're experiencing palpitations or any issues in terms of atrial flutter. The second is pulmonary embolism. A blood clot in the vessel in the lungs can trigger atrial flutter as well. And the third is COPD. This is a condition that lowers the amount of oxygen in your blood and can overall affect the rhythm in your heart as well. There's also lifestyle decisions that can cause atrial flutter. There are certain substances that people may take that can cause an irregular rhythm in your heart. This includes alcohol, such as wine, beer, or hard liquor, drinking heavy amounts of this drug. Also, stimulants like cocaine, amphetamines, diet pills, cold medicines, and even caffeine and coffee can lead to someone having an irregular heart rhythm and atrial flutter. Some people are more sensitive to these drugs while others aren't, which is why some may develop atrial flutter while others don't. So it's really important that if you're diagnosed with atrial flutter to look into your own lifestyle habits and see if you're drinking a lot of coffee, see if you're taking diet pills, or, ingesting drugs or other things. There are some risks associated with having atrial flutter. The first is vital organs, including the brain, not getting enough blood flow. This occurs because the electrical circuit is out of sync in the heart, and this causes it to not effectively pump blood to other parts of the body. The second is a greater risk of stroke or clot. This occurs because the electrical circuit is not pumping the heart effectively, and the blood can pool in the heart, causing a clot. The third is increased risk of congestive heart failure. Atrial flutter can weaken the heart over time if not treated, and this can eventually lead to heart failure. So let's remind ourselves what atrial flutter is so we can better understand why symptoms of atrial flutter occur. Atrial flutter is when the electric signal is abnormal and circulates in the upper chambers. When it circulates in the upper chambers like this, it decreases the delivery of blood to organs and the rest of the body. And so this can cause you to feel multiple things. You may feel palpitations because a flutter causes the electrical signal to be different, and so you may feel palpitations in your chest. You may feel shortness of breath because there's decreased delivery of blood to your body. You may feel anxiety because there's decreased delivery of blood to your head. You also may feel trouble exercising or fatigue because, yet again, you have a reduced delivery of blood throughout your body. You may feel confusion. You may feel lightheaded or dizzy since there's not enough blood flow to your brain. You may feel chest pain from the stress on your heart. And you may even faint because there's decreased blood flow to your brain, causing you to pass out. So, in order to diagnose atrial flutter, you may have initially had an EKG with the primary care or at a cardiology clinic, which prompts further investigation of the A flutter that was seen. Then you may have an event monitor. This is like a Zio or a Holter monitor to be able to see if atrial flutter is present and what percentage that atrial flutter occurs. This is to determine whether or not you go in and out of atrial flutter or if you're consistently in it. Lastly, you'll likely have an echocardiogram, which can show atrial flutter through the images and determine whether or not the heart was affected by the atrial flutter and has weakened, or if its pumping function is still normal. There's two routes of treating atrial flutter, and it depends on your medical condition and your preferences and the provider's advice. The first is the medication route. You can be prescribed medication to control your heart rate and rhythm to decrease burden of atrial flutter, often prescribed things like beta blockers. And you're also prescribed stroke prevention. This is a blood thinner to prevent your risk of stroke, which is higher in patients with atrial flutter. Secondly, you may also have procedures to try to get yourself out of atrial flutter and back into normal sinus rhythm. The first procedure is a cardioversion. This is when they shock your heart in hopes of resetting it back into normal rhythm. If this fails, then you may need an ablation. An ablation is a minimally invasive procedure where they go through the groin with catheters and either burn or freeze tissues in the heart that causes the abnormal circuit in the upper chambers that are firing. And so burning this tissue or freezing this tissue will theoretically put you back into normal sinus rhythm and stop the atrial flutter. Now, what lifestyle modifications can you make with atrial flutter? The first is to eat a healthy diet, to avoid alcohol and drugs, take your medicines consistently. This one is really important. Exercise, limit caffeine, manage sleep apnea if you have it, reduce stress, and lose weight or maintain a healthy weight. Thank you so much for watching. This is Amelia Heart and Vascular Center. Please look at our website for more educational videos and blogs. Thank you.